Well, hey, good morning. Today we are doing our Dallas Plastic Surgery podcast, and I have two very special visitors and friends of mine, Laura Suberg and Allison Spears. Today, our topic is going to be facial rejuvenation in the younger patient, and this is a very trending surgery that's been happening lately. We will reveal today that Laura has had her facial rejuvenation around a month ago and is already looking fabulous. So I want to talk to you about that. Allison, also a patient of mine, but has not had the surgery. And Laura and I thought that we'd bring Allison on to talk a little bit more about what are you doing right now to prevent it and what's around the corner.
Yeah.
What are you thinking as a consumer in the market? Gosh, when is it time for me to do it? Because no longer is the majority waiting until they're in their 50s to do the surgery. We read a lot about 30s and 40s. I don't agree with 30s. I think women in their 40s are doing this. Every magazine you read, 30s and 40s. I don't know if that's marketing to bring in more patients or what. I don't particularly find the women in their 30s ready for facial rejuvenation, but they certainly don't want it.
Right.
So I'd like to introduce both of you and maybe tell us just a little bit about you and your kind of relevance in the market, because both of you have significant experience in the aesthetic market. You're not just young moms looking into facial rejuvenation. So let's start off maybe with my friend Laura Suberg. Talk to me.
Thank you, Dr. Meade. So I have been in the aesthetic marketplace for almost 25 years.
Great. Good job.
And I've done a little bit of everything, which I love because it's opened my eyes to this whole incredible market that we're all fortunate enough to have worked in. So I've sold skincare, lasers, some OR devices, injectables, so a little bit of everything. And like you touched on, Allison and I have been privy to have a lot of this accessible to us for a really long time. And meaning we got to start at a younger age than most people. So in our 20s.
And you get to see the full spectrum of, does this laser work? Does this product? It really is different when you work in the industry. I mean, you see the trends, and I'm always cautious with trends because now we're starting to operate based on trends. And I think there's a lot largely from the influence of social media. You have to be careful with operating. For example, lip lifts, buccal fat removal. These are very trendy operations. They've existed forever.
Yeah.
And I did my fellowship in 2005. And those were just little procedures. But now, because of social media, they have blown up and so many people are getting them done. And I think some of those things will pass. Same as, the fillers, the lasers, all of those procedures. I think people now, they're super popularized. However, and Allison, I want to hear your thoughts on this. There was a paper published, Dr. Hammer talked about this. The paper's called something like $42,000 and counting. He had a patient that had all these fillers and all the lasers and all the skincare. And she had spent $42,000 and said, Dr. Hammer, I still need a facelift. And he was like, well, yeah, I mean, you've been doing things for the skin and it doesn't prevent the facelift. It does buy you some time.
Yeah.
So Allison, tell us a little bit about your background. And
Yeah. So quickly, I actually got into the aesthetic industry thanks to Laura about 20 years ago. And in the last 15 years was selling breast implants for Allergan and have seen the whole thing. So I, like Laura, had the benefit of starting all of the non-invasive stuff at an early age, which is amazing. And I remember at the time, I started getting Botox at 21, and it's because I was working for a plastic surgeon. And I never looking back thought, I'm going to do this now to prevent the aging process. But really that is in turn what I was doing, and I think there are so many tools we have in our box that you have in your box to take control of the aging process. That's what it's all about. So the earlier you start that, you can kind of control it. And that's the beautiful thing for patients that care about that. We have the ability to do that now, whether it's starting non-invasive, then moving into surgery. So it's kind of, the ball's in the patient's court, which is great.
I've found some of the procedures that I'm doing in younger patients around their 40s. Well, blepharoplasty, I think, stands in a category of its own.
Right.
There are so many people that benefit from a blepharoplasty. Historically, our upper eyelids, removing the upper eyelid skin, you didn't remove it until there was quite a significant amount. And it was sort of a dramatic change. And that's what I think has changed in the last about 20 years of my practice. We used to do, now we still do surgeries on those patients. The patients that have been saving up for decades, and she wants everything done, from the sternum all the way up to her forehead. But blepharoplasty now, very young patients, that is where I would say women in their 30s. I've even done a couple in their 20s. Some people have just bulging fat pads in their lower, and they need that surgery done. They're hereditary in nature. But a blepharoplasty can be done very subtly with just a little bit of skin removed. And it's no longer a part of your everyday.
Right. And so like you were talking about, that we've started a journey that we have access to. I had to kind of talk you into doing my upper lids because
Laura's a bit of a pioneer
and
for this stuff.
She had to talk her husband into it. And
That's right.
I was
I
was initially just like, I just don't think you're there yet. You just don't wait. When you see her before and afters, though,
it's true.
It changes everything.
It's a great point. Laura did have to convince me because I was thinking in Laura's best interest, you're not ready for this. It's just not necessary. There are many patients in my practice right now that I'm kind of pushing them off, staving it away. But Laura did show me, look, when I do this plank, when I do this position, other patients have told me when I'm on a jet ski and the neck, it'll catch the wind and it'll flap or something. But in certain positions, it's not that noticeable.
Right.
Those patients have been extremely happy with the procedure that Laura had.
But I think too that with Allison and I doing, little mini steps, like my bleph, I did my bleph a year ago, right? Before my face, which was 5 weeks ago. It just changes. Thank you. I feel awesome. It just changes the outcome, the healing process, everything. And I still look.
You mean doing it at a younger age?
Doing it at a younger age, but also not everything
in stages, right?
In stages.
Yeah.
And it just makes it a more natural, because I want to look like me, and I do right now. Thanks to you. But I also wanted to do it in little mini steps to where if I wasn't talking about it right now to everyone in the world that wants to see this, I don't think anyone would actually know. They would just say, Laura looks great. But it's that I've done it in a process. So that's, I think, what Alice and I want to share with people, that you don't need to wait. You can do, little things at Epicenter or in your practice to help the aging process slow down to where you still look like you.
Yeah.
Right. You're still aging. You're still going through the phases of life just looking more refreshed. And we've all seen things on social media where it's kind of brutal, where they're comparing the person aging without Botox versus the person aging with Botox.
Right.
And it's dramatically different.
It's drastic, yeah.
However, I think there's more than just Botox in those comparison photos.
Definitely, yes.
Something that we're seeing a lot of is, those Hollywood celebrities where we're comparing, what do the patient have? It's all speculation. Nobody knows what any of these, but we're talking about endoscopic mid-facelift. Back in 2005, Dr. Bird trained me how to do the endoscopic mid-facelift, and I found it to be very subtle, very mild. And I wonder if he was just ahead of his time, because now it is very, very popular to do these procedures. However, there's a lot of fat being grafted as well. And so early on, they look great. It is not a powerful enough procedure to do the aged face.
Right.
But for these kind of earlier on, younger facelifts, it might be a decent option. I think at some point right now, we should talk about the different types of facelifts.
And then talk about, just that I had my neck and lower deep plane, but it still looks like me. And we're going to talk about this in a little bit too, having kind of like your bestie to help you through the recovery process. But even though as a surgeon, you did kind of, I don't want to use the word aggressive, but a more thorough procedure than just the endoscopic, my recovery time was minimal.
Right.
Yeah.
Right.
It's surprising how operating on a younger patient also brings that. It brings less recovery. It is faster. People, For the younger patient who's in her 40s, she will never be, typically, common things become she will never be as healthy as she is. Now, sometimes people do lifestyle changes in their 40s, but in general, you're certainly never going to be younger, and it's never going to be less expensive because everything just gets more expensive with time.
Right.
And I tell patients all the time when they're like, well, maybe I'll wait until later. Okay, well, when you come back in 5 years, everything is a little bit different. Everything's a little bit more.
Right.
So I think patients are really accepting it a lot more at this younger age.
Yeah.
I want to talk a little bit about the types of facelifts and classifications of facelifts. The names and classifications of facelift have changed dramatically over the years. So this concept, deep plane, I'll talk about that in a minute. So the lightest type of a facelift is a skin-only facelift. Skin is incised, it's elevated, skin is pulled. Facelifts are about a century old. So a century ago, that's what they were doing. Some people are still doing that today.
Yeah. Just skin only.
Skin only. You separate the skin, you remove the skin. Like if you were removing, say, a mole from your forehead, it's going to lift the eyebrow.
Right.
A little bit, and temporarily, depending on how much you remove. Same thing for the face. It can be done. The problem is those scars will migrate. The tissues will stretch. The scars can widen because the skin is failing. So the skin lift, although it's amazing recovery, it's really fast recovery, it actually looks pretty good for a few months. And then you're cooked. It's not any good.
Right.
The skin isn't the issue.
In terms of long-lasting results.
There's no question that is it's an abandoned procedure.
Right.
Do some people do it? Yes. Who does it? Typically not board certified plastic surgeons, people who are not trained. Non-core surgeons, right. Okay. That's right. Non-core surgeons in facial aesthetics. All right. Next, the SMAS lift. Everybody has read and heard about the SMAS.
Right.
And it's very confusing. What is the difference between SMAS and deep plane? I don't get it. I do the deep plane procedures in my office. And even in the office, it takes a while before the staff understand, they'll see my Instagram things and they just to understand what it is because it does. It takes training to learn what these differences are. A SMAS procedure is a procedure that gets under the skin, and then the next layer is the SMAS. That's the layer that envelops the platysma muscle, that muscle in your neck that sags. The SMAS is around it, and then it goes into the cheek, and then it communicates all the way up with the forehead muscle, the frontalis. It's just kind of a layer within the face. And if you do a skin only, and then you raise up the SMAS, okay, they call those lamellar flaps, but it's still just a SMAS procedure. So the big bulk category after skin only is a sub-SMAS procedure. Now, originally, Dr. Hamra published a paper in 1994. It's called the Deep Plane Facelift, which is wild because he's in Dallas. He's a friend of mine. I love that, all of that information. Today, the term has kind of been changed. And my justice meter goes crazy because I'm like, wait, that's not what a deep plane is. A deep plane, as Dr. Hamra described it, is not only under the SMAS, but also raising the cheek fat close to the nose, all the way to the nasolabial fold. That way you can release some of those attachments. Okay, and then all of that is lifted. That's what a deep plane facelift was defined as in 1994. Today, it is being trained, and I don't appreciate or follow this classification, but that's how it's being trained today. And it's not like he's defining a mathematical truth. It's just the way he published. Okay, well today, I don't know, they're not calling it that. Now, a deep plane is really anything that is under the SMAS. Now, why is it being redefined for marketing?
Right.
Because doing a deep plane, I hear the patients telling me, oh, do you do the deep plane? Yesterday, I spoke to a patient who was telling me, oh, do you do the deep plane? How long does it take? And someone can do it in an hour. A deep plane cannot be done in an hour.
Right.
You're on the facial nerves. You're dissecting very near them. You have to find the zygomaticus major muscle, one of the smile muscles, to lift up the cheek fat. You have to be very careful in that area. And we'll talk a little bit about when I'm dissecting in there and if there's Sculptra. For example, if you were to operate on a Sculptra wrap, how easy does that make my knife?
Naming names.
Not naming any names or pointing. I might be making some hand motions. However, finding those planes in it, that takes a minute.
It's and a lot of technical expertise. Yes,
right.
Yes, absolutely.
And so that is a deep plane as it was defined, in the 90s. Now, through social media, anything that gets under the SMAS is considered a deep plane. Okay, it's a deeper dissection. It doesn't really matter what the concept though is for our patients to ask their surgeons. You have not had this yet. This is a concept that you'll have to consider and talk about. Are we getting under the SMAS, a deep plane? Are we lifting up the mid-face fat or are we not?
Right.
Those are the big questions that patients need to start asking, because the concept deep plane has been, I don't know, commoditized,
Right.
abused, overmarketed.
Overused, yeah.
And now anybody's saying that they're doing it, because today, if you're not doing a deep plane, the patients can just move on.
Yeah.
But then the surgeon might just say, well, I'm kind of doing a deep plane. That happens in everything that we do, by the way, in cosmetic surgery.
Right.
Preservation now for rhinoplasties. Every surgeon is going to do his own thing. So asking your surgeon the questions of what is the background? Okay, so we did skin. We talked about subsmaz. Let's move on to the next one. The concept smaz, by the way, came a surgeon called Tord Skog. He developed this procedure. And what he did was he started lifting the smaz and the skin together. And it was called a Skog flap. And so when you lifted that smaz and skin together, it kind of all came together. It even pulled on the neck a little bit because it's all attached. But if you don't release those tissues surgically, that stretch, it's not that different from just the skin lift, because you're just kind of pulling things together. And so I don't find the superficial procedures as effective. I was trained, release things, reposition them, let them heal in that new position. To me, those concepts are very basic, but many surgeons will disagree with this concept that I'm saying right now. Some of them will hear this and get heated and be like, no, that's not true. That's not necessary. That's where each surgeon, like an artist, says, well, no, in my hands, I can really control this better. To me, it makes sense. Release the tissues from here, release them, separate, reposition, let it heal. I don't think you can just kind of mush and it's going to heal the same. I just disagree with that
It
conceptually.
won't heal the same, but the long-term results, that's what is night and day, I think, from both of those procedures, the skin only and then going deep plane. So I was telling Laura, I was in Pilates Monday.
Oh, yeah.
And one of my instructor's mother was in there, and she had a facelift about 15 years ago from one of your mentors.
Dr. Barton.
Yeah, deep plane facelift. She was in her early 50s at the time.
Yeah.
And we were all laughing like, wow, you were an early pioneer. Like,
She was ahead of her schedule.
she was way ahead of the game.
Yep.
But she went in for a mommy makeover, and she was like, well, I think it was Dr. Barton might suggest, well, how many people are going to see you naked? And then how many people are going to be looking at your face for the next 20, 30 years? Right. But like when you talk about the deep plane facelift, she looks insanely good. She's 15 years out. I have no doubt you'll, heal the same way, but the results, you cannot argue with that long term.
And I love that you just said that, because one thing that I think that is hugely for us to talk about, which one of the reasons why Alice and I love you and support you, is you're an awesome surgeon. You're an amazing human being,
Sweet.
but you also don't brag about yourself. And what Allison was just talking about is that you were trained by Dr. Barton and people that pioneered this. And that's what makes you so good, because you were lucky to be
Very
trained
fortunate. Yep.
by these
Yep.
experts.
No
and
doubt.
that's why we send our friends, our family, and everyone
Well,
to
I
you.
appreciate that. I think you're right. I mean, the humility in me is because, I haven't invented it. That's not my thing. I'm not the one that's going to dissect into a new thing and see what happens. Not really.
Right.
I do love the idea that in 2005, Dr. Barton taught me a technique, the high lateral smaz, which is it's under the smaz, it lifts the midface, and it is a lateral vector procedure. In other words, it pulls a little bit towards the ear. They're all kind of conceptually vertical vector procedures. It's the procedure you had. Now, I can't remember his name. He's in California, calls it a vertical vector, a vertical restore lift. And he has great results. They look very nice. It's not technically perfectly vertical, a little bit of the direction when you're in the tissues. It's a little bit lateral, slightly. So then I hung out with Dr. Hamra, who taught me the composite lift. Now, this is a very different operation. The eyes need to be aged, the lower eyelids. And this is a superior and medial vector pull. In other words, the cheek fat is pulled towards the nose now, almost the opposite direction.
Right.
Which is revolutionary. It's fascinating. It is hard to do. It took me, I don't know, it wasn't until probably about my 16th year in practice, hanging out with Dr. Hamra, one-on-one. These aren't procedures for the mainstream. They're not. And so that makes it a little bit difficult. But the concept, I think we can talk about, which is pulling that midface fat towards the nose. It's a more powerful procedure. It is a bigger procedure. It is a bigger recovery procedure. But Dr. Hammer always said, "Oh, you'll be the town hero if you do this." Well, I mean, some of those procedures they're pretty big, and I can't have Laura 6 weeks out and she's still,
Right,
so
right.
We just have to talk about those different procedures. So I think it was great that you taught me. No, don't wait until you need to do the composite. It's okay to do the lower third of the face,
Right.
and be very effective with a deep plane procedure where I am deep to the cheek fat as well as subsmaz. Again, that's just a nuance. Some of the techniques also called a deep neck procedure. That's a new thing. Just everything needs to be deep. That's the new word. It's got to be deep.
That's the best.
And it's got to be preservation. And now everything's preservation. Everything's deep. I mean, I'm tempted to say, okay, I'm doing a preservation deep neck.
This is actually awesome. When I don't know if Allie was still in the room when you came in. You were like, Laura, your neck is so tight. You're not going to have a wrinkle for, I don't know what the number was, but I was like, yes.
Yeah.
And I feel like it is.
Yes.
They are bigger. Even your neck, I did still do a very aggressive neck on you. You healed very rapidly. I think it's because of your age.
That has to be it. The
to.
fact that knowing, I don't want to use an aggressive facelift, but she had a true deep plane facelift.
Right.
And 4 days later, I mean, she looked good 3 days later. I couldn't believe it. The way you've healed. So you attribute that mainly to age, right? I mean, great technique, but
there's a second thing. Okay, so because when the tissues are deeper, you kind of hide the swelling.
Interesting.
The swelling goes in, rather than when you're more superficial, the patients will be a lot rounder. There's, in the skin, you can see like little spider veins and stuff because it's so thin. You're getting all that inflammation there. Whereas when you go into the deeper tissues, it tamponades itself, which means it kind of stops its own bleeding because the tissues are separated and then they're pressed against one another. So I think some of that you kind of swallow that swelling. You're still swollen, as Laura can tell you. It felt tight. I mean, it was
right.
You're still going through it. It's just not as visible.
And nothing like you would see of a facelift of 20 years ago, where you're wrapped up for days and you look like a mummy.
Right.
I was just thrown away.
And I have y'all obviously know an 8-year-old and 7-year-old at home, and they basically didn't know I had anything done.
Right.
What did you tell them when you were going through the recovery? I mean, surely they saw like sutures and...
Yeah, they saw the sutures. It's going to be...
What do you tell your kids when you're a young mom?
I said, Mommy's going to go see Dr. Meade, and I'm going to come home and I'm going to have some stitches around my ears.
Okay.
But...
So they're not super curious.
No.
So it's almost an argument, do it before the kids start asking too many questions and that you can just dodge the whole conversation.
Well, Walt actually was the one that said, Laura, I think you should tell them exactly what you're having done. And I did.
Yeah.
And
honesty is the best policy.
Yeah.
My friends constantly ask me when they're about to get their breast done, like, what do I tell my children? I'm like, mine have been using them as breast implants as ice packs for 15 years now. So it's a very normal part of the Spears family conversation. But I think honesty is the best policy.
Wait, so if you put a breast implant in the freezer, does it freeze?
It doesn't freeze solid, but it molds right over the knee or the forehead.
Oh, interesting.
Yeah.
Okay, good.
But yes, that is a great question though, because moms are always asking, am I going to cause a complex if I show my child that I'm getting my breast lifted or my implants exchanged or a facelift? And I think it's a very easy conversation of there are moments in life, whether it's, from nursing or just aging, where you're doing things to regain and restore confidence.
Yep.
And I think kids will understand that one day. And honesty is always the best policy, I think.
This is a great intro to the conversation of your spouse versus your hype girlfriend to come in for your surgery. I have discovered, let me just tell you, I have discovered something here. Now, for some patients, it just depends on the couple.
Right.
For some patients, the husband is the one that needs to be there because he wants to ask questions. He wants to learn how to change the dressing. He wants to be there. And that's okay. But I think it's also okay. Not every husband or spouse needs to be like that.
Yeah.
Some can't stand the sight of blood. It's just not going to work. And that's okay. We're all wired a little bit different.
Right.
The spouses often are the provider, often are the protector. That's not necessarily the best nurse.
Right.
Now, again, for some patients, the husband is the perfect person that needs to be there.
Yeah.
he's cycling the blood pressure cuff and checking the O2 sats. Some. That's rare.
Sounds like the minority, though.
The minority, right.
Who might be in the medical field.
Maybe,
Right.
For others, and my nurse Allison and I discovered this, when a girl brings her hype friend, that is a friend that, number one, doesn't judge. Number two, is supportive, in fact. Or maybe she is judging. She's judging in support of you doing this.
Right.
And she just knows also this is going to be fine.
Yes.
How does she know it? She hasn't necessarily had the procedure. She's maybe seen others that have had it. She just says, this is going to be so worthwhile. I know it hurts. Just hang in there. And I have seen the patient's recovery through this. It's a dramatic difference.
Wow.
So I want to hear you guys kind of going through this. Particularly Laura, having gone through, what is it like, and what do you think would have been the difference if it had been the wrong person accompanying you? Let's not pick on, I don't want to pick on anybody.
We're not going to name names.
Yeah.
But so as y'all know, Allison and I have been best friends for, almost 20 years. And I rely on her for a million things, but just also when I need help. And so she did so many things for me post-procedure, bringing me protein and all the things that you're not thinking about post-surgery because you're probably not hungry. And
there's so many things to think about.
And there's so many things.
Right. Yeah.
And, checking my incision sites and something that we talked about too, that a million things that you do in your practice specifically that set you apart from so many others is kind of the concierge service that you give to everything like this, that, if there is a patient that's scared of the recovery process, we have the ability to go check on the patient and, because a husband,
Right.
some of them not necessarily want to look behind an ear and clean an incision site. And the patient might live a little bit further away and they can't be going to Dr. Meade and seeing Allison all the time for post-op. But having, the bestie come check on me was invaluable.
I think it's the coolest idea.
And just saying like, you look awesome.
Yeah,
And
just the emotional
And you're going to make it
support.
through it. Yeah. Well, but just in pre-op alone, I think, your partner, whether it's your spouse, your partner, they are worried. The person they love is about to go
That's
under
right.
general
That's
anesthesia
right.
and temporarily look different for a minute.
Yeah.
well, and let's
Scary.
talk about
That's a good point.
pre-op.
Yeah.
So you, I think, kind of like chuckled a little bit when you first saw that this was my person and pre-op. And
Well, I didn't know.
right. But, I love my husband. But
the entire
it was,
Dallas-Fort Worth Metroplex. So,
so does she. But so it was gonna, there's no way that I can sit here and say that I had zero anxiety before going to surgery.
Yeah.
And I picked this human to come in and sit with me before because she wasn't going to ask me a lot of questions and just sit there and distract me and calm me down, where I know that my husband loves me more than anything in the world, but it was just
It's
going
just
to.
different.
we try. Yeah,
Yeah,
we
you try, and we love you for it.
Yeah.
But that is
It's
the role
different,
of
yeah.
the friend.
And we're aware. I think.
Yeah.
That's another question.
yes.
What does the husband feel like he's being dismissed somewhere? No, I would assume.
No, he felt okay with it.
Yeah.
He wanted to be informed
And yes, and be there to support you. But yeah, that's the role, is assuring them, because again, I tried to talk her out of this for a year. I was like, I don't think you're ready. But when we were sitting in pre-op and she was looking down, we both did, we all did. And she was looking down, I was like, I get it. I completely get it.
Yep.
We've been through this a million times. I've nursed many friends through it. And I'm like, you're doing the right thing. You're going to look awesome. And just keeping her calm. Because, right before y'all go back, I could tell her nerves were going up a little bit. But Laura was the perfect patient pre-op and post-op. And I think that is the preparation that y'all give your patients. Your staff, she was so informed, so well educated on what to expect. And I think that's why she sailed through it, because she was very educated on every single day. So just going back to what you were talking about, Dr. Meade, about the socially acceptable age for a facelift, it's drastically changing.
what's
and
that
that's,
there?
well, I mean, that's what I get
say?
it all the time. They're like, no one could believe Laura had a facelift, when she did it. And they're like, you're Laura, your friend Laura. Does she need that? How old is she?
I mean, I'm looking at her neck. Every time you look over, I want to take a picture of it.
Yeah,
It's
the
tight.
profile is insane. But everyone wants to know, how is she doing? How does she look? And Laura and I have been through the same journey. So I'm 43. I started doing, Juvederm and Botox at a very young age. And I love it. And it is restored, it has kept the volume in my mid-face. But again, as time goes on, my profile is going to change. So, and Laura was kind of in the same boat. She has sold, hyaluronic acid filler for years. She's done it all. And there was a point a few years ago, I was like, I think you've done too much. You need to tap the brakes with
You
the
told
filler.
her.
I said, it's too much. And she's like, well, you don't get it yet. She's like, I am getting heavy down here. And I feel the need to keep on plumping. And
did you feel,
lifting.
Laura, that the product made it feel even heavier or no? See, because
So this is yes, and this is a question that Al and I
Product
get
and volume.
and
too.
volume,
Quantity.
all the time. Where
I see what you're saying. Yeah.
Right.
when people ask us like where to go, who to inject, I mean, we always say, Epi, because you're never going to have a provider at Epicenter that is going to say, I'm gonna, put so much sculpture in you or, HA in your jawline to give you the effect that I would get from this. Mm-hmm. And when you have a best friend that says like tap the brakes, I said, you're right. And so I quit doing filler because at that point, I'm going to be 49 in June. I was maybe 46. Mm-hmm. I was never getting the lift, the tightening that I needed.
Yeah. Just you reached that point where the fillers just could no longer lift.
And so I stopped. I just stopped because I knew my next step was going to be neck and surgery. And so like for Al, since she's a little bit younger than me, what she's doing right now was working. It wasn't working for me anymore. Mm-hmm. And I think that's what's so important with, kind of your mid-level, wherever you're going for lasers, injections, that you have to go to someone like we work with at Epicenter that's trustworthy and isn't going to have their hand out just taking your money saying, I can provide you this chiseledness or whatever you're looking for. And I tell my friends that are my age, I'm like, for what the outcome you're trying to achieve, you're probably going to pay $8,000 that may or may not give you the results you want, is only going to last a year and a half. That's $8,000 they could be putting towards
surgery.
Their neck and look
now,
face.
that's also, just to be clear for people listening, not a discouragement to do.
No, because she's doing it. I go
required.
Yeah, I go for Botox every 3 months. I get Juvederm in my cheeks and lips every 18 months. I will do it forever.
I think lasers also. I think lasers and skin pen are two things that are
great
just,
great skincare, retinol. I mean, I think it's the fountain of youth.
And that's what also I think has really helped Al and I in our aging journey is that we have done that. We both get once a quarter either a BBL or a Moxie or
not to be confused with the Brazilian butt.
Yes,
we're not quarterly. This is
it's important that they're seated
laser. But we're getting regularly, treated at Epicenter for prevention and preservation.
Yeah. Yes.
That's for the fabric. You're treating the material,
right.
And then surgery does a different thing. Okay.
But along that journey, I mean, my day will come, and the perfect age, who knows what it is. But, I truly believe it's exactly when you did it for you. Maybe different for everybody, but it's like breast surgery. People are like, why? I'll just wait. I'll wait till I have kids. I'll wait till I do this. But why wait? You're young once.
That time is right. It's
different for everybody.
Right. It's different for everybody.
Yeah.
You found, I think, a really great time. It's too early for you.
Right.
Some of my older patients, they just chose to wait.
Yeah, they just wanted to wait till later.
But I think that the choosing kind of our conversation and friends, the choosing to wait till later. I mean, if it's a monetary discussion, that's different.
Right.
But if you have the means to do it earlier, then you do it earlier because
Just
you still
enjoy it
look
along
like,
the way.
Enjoy it
and then you
longer.
get to still look like Laura.
Well,
or-
and surgically, just
Right.
to chime in on that, surgically, you are able to separate this portion of the face with the upper portions. In other words, lower eyelids, upper eyelids, and brow can be done totally separately
like
from that lower face. So it's not unreasonable to do this now, continue to age. And I do suspect, by the way, eventually we'll be talking about a bigger procedure when you're
Correct.
60. You know, I
Right.
mean, I don't know what age that would be, but
Right.
that lower face, how long does it buy you? I don't know. I mean, I'm seeing the patients now, I don't know, they're 5 years, they're 6 years out. I think they're going to be fine. I think they're really going to hold up for another 10, maybe 15 years, maybe longer. You know,
Yeah.
everybody ages so differently. It also depends on how they're taking care of their skin along the process. So
Yep. Well, you look amazing. Your recovery was awesome for me. Was it good for you?
It was. And I think that's something that Dr. Meade and his amazing nurse, Allison, will highlight too with my before and afters. Just, I mean, the first thing that you commented on, I mean, I told Dr. Meade that I think that he had Jesus in his fingers because my scars around my ears are, you know, invisible at this point. I'm already confident wearing my hair pulled back.
love it.
You know, I
You're
still
1
have,
month, right? Okay.
yeah,
Yeah.
yes. And I still have the incisions, you know, behind my ear, but those are disappearing as well. But no one would know
No.
when you sitting here staring at me right now. These are invisible. And for my neck procedure, my incision was below my chin, which is invisible too. So, you know, if that's something that is keeping the patient from, you know, being
Pulling the
hesitant,
trigger in. Yeah.
it's
That's a great point. A lot of
but
patients do
non-issue.
talk about that a lot.
Yeah.
Good. That's helpful.
Well, she was also out buying flowers 4 days later, and her scars looked amazing then. So she may be the exception, but she looks incredible.
I was expecting that. I didn't. You can't hold Laura down.
No. Just a little ball cap temporarily.
Okay. Well, thank you, ladies, both very much. I think that was really thorough and informative and helpful. Laurel, you look beautiful. I can't wait for your day. That'll be fun.
Right.
Everybody's going to be watching you now.
I know.
And I guess it looks a little tight. So thanks so much for coming. And thank you guys so much for listening.
Yeah. Thanks.
Bye.